Hey, Lefty. You can unmute yourself and say hello. Oh. Okay, 7:01. Time for people to start showing up here. I'm starting this meeting on time. I expect people to show up on time. Huh.
Hi, Ken. I'm in my car. I'll be stopping soon.
Okay. All right, Lefty. Hey, Gaetano.
Hey, Ken.
How are you?
Alrighty.
Good.
Taking this trying to take these calls from my phone so I learn how to use it a little bit better.
Uh-huh. Jim Miller's here. All right, Jim.
How's it going?
Not bad.
Doing something down here.
If you consider going to the emergency room in the morning, a not bad day.
Oh, what happened?
Oh, I had a infected paronychia infection around the fingernail, and they had to drain it.
Yeah.
Yeah, yeah,
If you
wasn't
give me
terrible.
give me 1,000 guesses, I wouldn't have come up with that.
How the hell did you get that?
That's what they wanted to know, and I said the most dangerous thing I was doing with my right index finger was opening pistachio nuts.
Huh,
So they don't know.
interesting.
It just comes along apparently from time to time. You get an infection along your fingernail. I had one about 30 years ago, and I asked the doctor what I should do for it, and he said, "Oh, just stir your morning coffee with it."
Oh, I would say soak it in Epsom salt or something, but
Yeah, well, yeah, but I was smoking it, soaking this, and finally I went
Oh,
to the urgent care center, and they gave me antibiotics for it, but the antibiotics
oh,
weren't working. It was getting worse.
oh wow.
So then I had to go to the emergency room today, and they opened it up and drained it, and
Oh wow.
we'll see how it goes. Anyway, it's not as painful now, so that's good.
Yeah. So the pressure's off, that's why.
Right, right. But unfortunately, it's not a qualifying condition for marijuana therapy, but
Well, you gotta expand that.
well, actually, it does cause chronic pain, or it does cause pain for one thing. And the
There
other
you
thing is
go.
there's a lot of anxiety associated with it.
There you go.
So anyway,
We got you covered.
yeah, Jim, did you get a chance to look at the ASA um, um, suggestion that we join forces in some way? Uh,
You mean Samson? Wait, not Asa.
ASA, Americans for Safe Access.
Oh yes, yes. Okay.
Anyway, so just looking for board approval on that. I
I
already
said,
told them I thought that, from what I heard from the board was very positive. So
mm, I I emailed you back and said yes. So
yeah, yeah, thanks. I appreciate that, guy.
yep.
Hey, Jared, how are you?
yeah.
Hey, how you doing?
Good.
Yeah, I like Asa. I mean, unless there's something I don't know, I've always gotten along good with them, and
Mm,
they've come here and done some good before, when
Yeah,
they
yeah, they've helped us out in our.
Mm. So I'm good with that.
what does the partnership look like, Ken? Like we just support?
They want to offer. Well, they want to put us. And she gave some details in the
Oh,
email. I don't have them right
oh,
in
okay.
front of me, but that I sent around. She wants to allow anybody we recommend to get a free membership in Americans for Safe Access. And she was saying, well,
Oh,
we should use our members to offer them that. And I said, well, we don't have members actually. We have
mm,
I have a list of 2,000 people that I send emails to. Uh,
all right.
and I told her about our Facebook page, and she said, "Well, no, this is more for your list, So I'll send them an invitation to join ASA for free for a while."
Oh, okay. And how big is their organization?
Well, they've got a beautiful website. I mean, they've got a
Yeah,
ton of information on their
yeah,
website. And of course,
that I know.
they're a national organization. I don't know the exact numbers that they have there, but they started out in California, and then they were also going to have a very big presence in Washington, D.C.
Oh,
So
well, can we do this maybe? Would they be able to make a presentation to us, go over their mission statement and all that stuff? Or what do you think?
uh,
That would be,
well,
and we
I,
could.
I think she may have already done that actually when she sent
Oh,
in the email, but I think we just
oh,
have
all
to
right.
review the email a little closer, and
Okay.
and find out.
All right, we'll do.
Hello, Ed, and Mike. Welcome. Ed, you're only 7 minutes late. This is it's a very spooky thing here.
Hey, I had a lot going on today.
I didn't mean to laugh so heartily when I heard that though, but
Ed's
I used to be,
basically
you
on
know,
time.
well, the only nickname I ever had was the late Jim Miller because I found it hard to be on time, you know.
Uh-huh.
And then I lost that. Cheryl died. It seemed pretty freaking inappropriate to call me the late Jim Miller, you know, but I got my ways now. I'm simply fooled by setting my alarm clock, putting it 10 minutes fast. Now, how does that fool me? It does.
I do the same thing. And I remember it's fast.
And then just for a kick, I set the clock that's on time. I mean, I can see the automatic one, but the one I normally look at, I just bumped it for 2 minutes because I felt like it. Life's been easier. I'm easily fooled. Yeah, I was so often late with Cheryl for doctor appointments that they had me fooled for more than a couple of years, I understand. That they would always tell me the appointment was 15 minutes before it was. And the only reason I know that is my MO was I'd get there and I'd jog in and say, okay, sorry, we're late, you know, I'll be right in with Cheryl. And I could get her in her chair. And I come in, but I came in one time and I walked halfway towards the desk area and I said that I didn't recognize the woman there. And she went, Mr. Miller, no, you're on time. And somebody else said, wait, 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 wait. And they came up and went over it with her and it clicked, you know, and turns out they owned up, they fessed up for years. And I was quite proud of them, you know, they didn't have to confess to me. I said, man, you know, that's some good skills. But a little embarrassing for me. I blamed it on her. What are they
All
going
right. And Mike's here with your dogs. How's everything, Mike?
Yeah,
to?
we've already met the new girl, and good to be here. Would have been here quicker, but there was more than one link on that, and I ended up at a Zoom page for something
There's more than one link on what?
on the CMMJ email that went out.
Really?
Yeah, but inadvertently I hit one and it took me to Zoom. I don't know, some marketplace thing for Zoom.
Huh. And then what'd you do?
I went back and looked for the other link, which is where we are now.
Okay, but was it on the email?
Yeah, they're both on the email.
They were both on the
The
email.
one was more prominent. I think it was more like a Zoom ad,
Okay.
but I said inadvertently I ended up on that page. I thought I was coming here, so
Yeah.
hopefully
Okay.
that doesn't happen to other people trying to find us.
Yeah, I hope not too. I'll have to look into that after the meeting. All right. Thanks for that, Mike.
Friends of the Coalition site had it, you know, right. One of the few times let me go to Facebook, Friends of the Coalition website. Boom, there it is, right in.
Yeah. Okay. All right. Good. Good.
I usually have trouble myself. It follows me around. I can't help it.
All right. So I guess we're ready to get started.
Are you recording these now, Ken?
Yes.
Yep.
We are recording and Nick is supposed to be
YouTube?
converting them into YouTube, and
Oh,
then
nice.
they're available on our YouTube channel. So I hope everyone
Nice.
has signed up on our YouTube channel, and
Yes, yes.
we need.
So that means we can't curse or say anything sus, or we'll get you guys kicked off YouTube or anything, right?
Right.
Oh fuck,
Right.
no way.
Shit, no way.
No fucking cursing around here.
No
Yeah.
shit, right. Friggin'
Oh shit! I said fuck. Oh fuck! I said shit. That was the original.
Oh, he's not recording yet, so
HBO.
gotta do it all over again.
That was Murray Langston, the unknown comic, by the way. His first time on HBO when he could first swear.
Oh, he was funny, the
That's what
unknown comic.
that's what he did, and he just got me from the beginning, you know. And
I
when so,
rem-
there you go, because then who gives a fuck? Oh
I-
shit, fuck. Oh fuck.
Hey, Chuck. Hey, Chuck.
I remember him from the Gong Show.
Yeah. Well, he did it though, actually, without his paper bag on, though. You know.
Yeah.
On HBO.
Well,
On
that
H-
means
on
he was
HBO.
known.
Yeah. That was a great show, the Gong Show.
It was, man. I'll tell you.
Interesting film they did about that later on.
Oh
Whether
yeah.
it's fiction or true, they portrayed it as true.
Look, you know, hey, listen, Lean Gene the Dancing Machine was the best.
Yeah, did you see the movie where what's his name? Gene Barry, the guy who came up with it.
Barrett, Jim Barris.
Chuck Barris.
Chuck Barris. Thank
that's
you. Chuck Barris was actually an international assassin for the CIA, and they used all the international trips with the couples on the dating game for him to go out and make his hits. It was a funny movie. But yeah, you had to check that out if you're into the Gong Show.
All right.
All right, back to the meeting.
Back to the meeting. So this is the meeting, our closest meeting to the November 5th election, the national election. And, we really need to encourage cannabis consumers to vote, to register and to vote. And, obviously we can't take a partisan side on who to support in this election as an organization because we're a 501c3, but we can talk about, their positions on cannabis. And the important thing is that no matter who you vote for, it's important to get out and vote. Just like, senior citizens have so much respect from the legislatures and Congress because senior citizens vote. And
so would using pronouns rather than real names, would that be wrong?
I go by fungi.
I was thinking of just vote for
calling them,
candidate.
like.
Oh, wait, one at a time. What'd you say, Ed?
I said just say vote for the sane candidate.
Yeah.
Was this going to be an introduction to the ASA program?
Yeah.
Go ahead, get back to it. It sounds good.
The major party candidates, they both signaled support for cannabis policy reform. So there is a nice article on where Trump and Harris stand on legalization. But following former President Trump,
where they say they stand, I really wish people would, not you, but when somebody issues where they say they stand, I'm good with that. But to say this is where they stand, come on, seriously. Now, quick minds can change or how truthful things might or might not be. But I'll give you, where they say they stand, and
let's see if
anyway.
And the orange slime bucket lies, so I don't give a shit what the asshole says.
The program with ASA, I had a meeting with them a couple months ago on this, and volunteers reached out to different politicians, legislators, and asked them what their positions were, and recorded it. And that believe this is an extension of that same program. If it's not the same program, so that when you want to look at a legislator, where do they stand on cannabis, on medical cannabis with ASA? And we look at it right there on a chart.
So the link that I have is to the Marijuana Policy Project, and they say that Democratic Party nominee Kamala Harris on cannabis reform has undergone notable evolution in her stance on cannabis since her time as a prosecutor. As a senator, she advocated for and introduced multiple pieces of legislation to advance cannabis policy reform. And most recently, she came out and said that making marijuana legal at the federal level is the smart thing to do. It's the right thing to do I know this as a former prosecutor, and I know it as a senator," added Kamala Harris. So that's pretty clear. There's a little more there. And Republican Party nominee Donald Trump on cannabis policy reform, he evolved his position after many years with an inconsistent record on the matter. During his run for president in 2016, Trump said that he backed medical marijuana and that legalization should be left up to the state. But as president, Trump supported U.S. Attorney General Jeff Sessions' move to rescind the longstanding Cole memo, the key document issued by the Department of Justice in 2013, establishing a general federal policy of non-intervention in state cannabis laws. So he did not endorse or advocate for any federal bills throughout his presidential tenure, but has also generally maintained that legalization should be left up to the individual states. Let's see.
Yeah, just like abortion. Look how that's going.
Yeah, right.
And
So
look,
if you're lucky enough to be in
Ken, what you just read, Ken, is called sane washing. What he really said was, he's an asshole.
Step right this way. Have I got an opinion for you?
So just because he's an asshole doesn't mean that we are endorsing anyone. We can endorse assholes.
We don't endorse.
Please.
We don't endorse.
Following former President Trump's recent announcement of support for a cannabis legalization ballot measure in Florida. Now that was interesting. He came out and said that he supported the ballot measure in Florida. But the campaign
that's the way the wind was blowing. That's why he's so damn transactional.
No, he's pissed at the Satan. That's why he did it, because the Satan doesn't want it, so he wants it. He's a child. He's a moron.
Right.
Yeah.
You guys are being even meaner to Trump than I would normally be. I think that's very funny. So carry on.
I'm being mild.
I haven't started. Yeah,
Okay.
exactly. I haven't started yet.
I mean, I've got my own beef with the man, but I haven't even said anything that mean about him.
All right. It is being recorded now, people.
Yes, this goes to posterity. Anyway, but just to finish that, Kamala Harris said that while in office, Trump took marijuana reform backwards. So Americans for Safe Access has launched the Compassionate Candidate campaign to amplify patient voices. So this initiative provides candidates a platform to learn about patients' needs and to showcase their support. So we're encouraging people to go to Americans for Safe Access, their Compassionate Candidate campaign. JB.
Very good. Oh, did you see, back to the politicking, the vice presidential candidate for the GOP made a comment earlier about how THC infused candies and fentanyl induced weed is coming across the border. Watch out for Halloween. He's just stirring up the same old shit from 100 years ago. And that was the thing he just quoted today, folks. So we still got Jim Crow on board.
Well, I don't know if you guys noticed, but there was that article in the New York Times recently about cannabis hyperemesis syndrome. And, you know, the New York Times, I got to say, their editorial standards have really, really slipped over the past few years.
Yeah, that's true.
This was I understand wanting to, you know, warn people that there can be some downside risks of cannabis use. But at the same time, first of all, cannabis is a drug. Any drug is going to have some downside risks. Any drug is going to have some side effects. Doesn't matter whether you're talking about cannabis or atypical antipsychotics, for example. The difference is you have to, how can I put this delicately? This is why I would like to see any federal legalization bill have some kind of research provision in it. There should be money from any taxes collected set aside for medical research and things figuring out what causes the hyperemesis syndrome and how can it be treated.
Okay.
That's just one issue out of many that I could name here. but like, I would like an actual, rational discussion of these things and not just more scaremongering, because I feel like if people, too many people give into the scaremongering, we're not really going to see serious progress on this. We're going to see that kind of uneven, peak and valley sort of thing where there's alternating fits of like prohibitionism and liberalism that kind of alternate with each other, which is not the way I'd like to see it done.
Yeah, but
The
you know what?
CHS I'm sorry, I didn't mean to cut you off.
Please, no,
CHS
say what you're gonna say,
conversation
please.
has been happening with adults in the room. There's been the cannabis clinicians have been having different panels on it. Conversation's been going on for a while among clinicians.
Yeah.
However, among clinicians, that's a relatively small minority. Of the medical providers, the AMA is not on board with weed. After what the federal government pulled on them 100 years ago, I can understand that. 10,000 doctors getting pulled into prison because they prescribed weed back in the 20s. But that's another story.
And look up Ethan Russo speaks on hyperemesis syndrome quite a bit lately. Him and Cody Peterson on LinkedIn, pharmacist. They've been speaking on it lately. And also too, though, Jarrett, when the rescheduling happens, I think the government is going to have to absolutely do research and set dosing standards and other things. So, which should be a good thing. Let's just put that down.
But if you look at CHS, I understand what you're talking about, editorial standards being a wash.
It's not just about that topic.
That whole industry has been flushed. So, and journalistic standards are something that we have to look at. But what with CHS, we're finding out now that legal cannabis plants that have gone through inspections and testing and everything else are coming up, and they're testing positive for these new compounds that were being smuggled in from China that weren't even on anyone's list. So we're what I'm getting to is possible causes for CHS. Yeah, we got a lot of stuff coming into. Cannabis is pretty much around the world, and yet where's CHS? We got a whole lot of questions to ask. Now, where's it being hit? Is it just in North America? Are we seeing this also in Europe? As far as cannabis use in CHS,
are there that many cases of it, or is it just that when the cases happen, they blow it up?
It's real.
No, I know
it
does
exist.
No, I know
but
real.
You're right. When journalists get a hold of it,
right,
it gets blown up.
Right. Yeah.
I had an EMT come in here to pick me up in an ambulance one night, give me a ride into the ER, and she started ratting on me like back during legalization. My place is pretty much decorated with weed, and so you have weed and you're nauseous. So I guess that wouldn't be CHS, would it?
Huh.
And I already knew what the cause of it was. And I said, "Thank you for the diagnosis, doctor.
Yeah, really. Yeah.
Open for practice."
Yeah.
And she shut up. Helps if you know how to talk to people.
Yeah, cannabis hyperemesis syndrome does exist. It is very rare, but anyway, and they don't really know the cause of it. I've always suspected it could be caused by pesticides. That were, it wasn't the cannabis itself; it was how the cannabis was grown. So, but
we don't know.
My take on it is that your body is even more smarter than the cannabis, and it knows when the receptors are full, and it's saying it's enough. That's my take on it.
I've heard multiple different theories about this. I don't know what to believe yet.
Okay.
There's not really enough scientific literature on it to make a determination.
Right.
And that's just one thing. Like what else can we do with the plant is, that's another question that, like what kind of clinical trials can we have?
Mhm.
And that leads me to the other thing that I was thinking about with regards, Ken, I'm sure you were going to mention the hemp bill that's sitting before the state legislature right now. I don't
It,
know.
it
Has
was
that been
signed. It was
signed already?
signed. It was signed into
Oh,
law by
was it?
Murphy. Yeah,
Already done.
yeah.
Oh, that's
done.
right. So when does that take effect? I'm curious to know because I
I think, don't they have 60 days?
Well, they have the hemp industry has 30 days to pull their products off the
Right.
shelves, and this is. But now they filed a lawsuit against that law, and they said
Right.
that it's going to destroy the hemp industry. Not only is it going to destroy the hemp industry, but it violates the 2018 federal farm bill. So
because I know that Governor Gavin Newsom over in California signed a similar thing.
Right.
And there's been a mad scramble by a lot of consumers to buy up these hemp, synthetic and semi-synthetic cannabinoid products before they're pulled off the shelves. And for a lot of patients who use those either because they prefer it to regular cannabis or because it's milder for them or whatever, like they're feeling like they're getting left in the lurch. And again, this is something else that I feel like more research and more knowledge would be the antidote to this, because you have these companies that are creating and marketing these hemp derived cannabinoids, and we don't really know how much different they are from THC and whether or not they're milder or whatever. I mean, again, this is a time when I think prohibitionism is not the answer to this, but neither is this Wild West approach of just let anybody sell whatever they want and put it on the market. Who cares? There's no real industry standards or anything for it. Like, there's got to be a happy medium to strike, a compromise to be struck here. And I don't know. It would be nice to see. It would be nice to see a voice of reason for a change over this stuff, rather than see. This is what I'm worried about. I don't want there to be this constant cycle of panic and then leniency over any kind of cannabis product at all, whether it's hemp derived or otherwise. Like, this can't be a recurring pattern
I
that
think
we're going to have to deal with.
I think again the rescheduling probably is going to help quite a bit of this.
Well, yeah, because you're going to have big farmers take over the whole thing. What
No,
we're looking
I
at
don't
now,
know.
because not just hemp-derived cannabinoids, there's a ton of neocannabinoids that are yet to be discovered, let alone the
Right.
therapeutic values. And what about yeast-derived cannabinoids?
Right.
I mean, just because you have a cannabinoid doesn't mean it came from cannabis.
I put a link in. I put a link in the chat for a very good webinar. It goes on for an hour and 20 minutes from Doctors for Drug Policy Reform about the Farm Bill, hemp-derived minor cannabinoids, and regulatory mayhem is the title of the webinar. And it's a very good introduction to the minor cannabinoids and the problem that we're having with synthesizing these cannabinoids and then making them available in gas stations and whatnot. Yes, Ed?
I just have a question on hemp. This is naive of me, but does this have a direct impact on medical marijuana patients?
No, not that I can see. I mean, medical marijuana patients still have full access to
the dispensaries, yeah.
to
Medical.
the products that are available in the alternative treatment centers.
And and it's
Okay,
just
so
New Jersey.
no
actually-
slippery slope here then. No
What's that?
slippery slope, right?
What's that?
No slippery slope.
No. Actually, I think I supported that bill. I thought it was good to have these products licensed, only available through licensed Cannabis Regulatory Commission.
Yeah, I supported it as well. I went down and I
because-
submitted written testimony. I supported it as well.
You don't know where it comes from.
No,
if you don't control the
Right.
the contents, the production, the
Testing,
labeling, the
yeah.
packaging. This is what we're going after. We're going after
Safety.
trying to protect the public.
Public
And
safety,
that was the justification for
Right.
the governor signing this bill. And he said it wasn't perfect. I mean,
Right.
I like the idea that the the liquor stores are going to be, they're going to be allowed to sell infused beverages in liquor stores, and that's going to be regulated by the New Jersey Division of Alcoholic Beverage Control. But anyway,
I've been buying them for months from my local liquor store. They had several different brands of their THC infused seltzers. They're strain specific, cultivar specific, pretty much seltzer waters, flavored, but they're sativa. Usually it's
How much THC?
it's like
7%? No.
you got 20 to 5, so 4 to 1 ratio. It ends up being 20 milligrams a serving. In a can, you get 4 servings. So there's 80 milligrams in a can. So you sit back and knock back a can. You're feeling pretty good after a while.
Yeah, that was going to be my question. How does it feel? It's sort of like I'm that guy that, like when there's a weather report and it's like it's going to be 88, but it feels like 105. I'm interested in what it feels like more than the number that gets assigned to it. And also the number that would be the dollar amount, because I always have to do a cost of.
But the way you feel from it could be different than the way somebody else.
Oh, it will. But but I know Mike's tolerance level and vast experience with with cannabis. So are you saying you're pretty well? If you are buying them, I'm assuming you're pretty satisfied with it.
Yeah, they're more of a novelty thing. I have company coming over, something like that. It's like Jim Miller's
and you
coming
don't
over.
tell them. Oh yeah.
So you use it, you use it for enjoyment, not medicine.
Well, yeah, it's a novelty thing. I get non-alcoholic beers right next shelf over, and we're laughing, and then I know more about the product that's on the shelf than what the people that work in the store do.
Yeah, sure. How are they advertising it and marketing it, or they aren't?
As far as I know, it's just sitting on a shelf.
Just sitting on a shelf. That's
they're on the shelves, because that's what I heard was they were going to be taken off shelves and put behind the counter or something. Was that in it?
So, like I said, the hemp industry has filed a lawsuit against this law. It's now a law since Governor Murphy signed it. But the state came back and said they filed a response to the lawsuit, and they asked the judge to throw out that lawsuit and said that it was a legitimate response to a public health crisis, and that they should, toss that lawsuit and keep that law in place. But even Murphy said it wasn't a perfect law. I mean, there were things that would have to be followed up. There might be clarifying legislation passed in the future about this issue.
That's really good to hear him say that. And I also liked when Nick Scutari was doing his best to get the law voted on. I mean, passed in the legislature. You don't want to let the perfect be the enemy of the good.
Right.
So keeping that in mind, that if Governor Murphy understands that a bill doesn't have to be perfect, he should understand when we do get around to a patient home grow bill, when it comes time, eventually, hopefully it will obviously at some point, comes for his signature, that he remembers that wisdom there, that whatever his reservation might be, if it gets to his desk, he needs to sign it, and then if it needs to be fixed, we can do that. We still don't have our alcohol laws finished. How long have we had legal alcohol since Prohibition? Still doing cleanups on that. So that's good to hear, though. I mean, that's good, solid reasoning. I'd like that always to stay at the forefront when it comes down to advocating for any change in a law, that it has to be better than what we have, and its shortcomings, when they become more evident, you take care of them.
Yeah. Now, Jen B wrote in the chat that she read the New York Times article, if we can go back to that for a minute, and she was disappointed by the scare factor. And so, yeah, it was a scare factor. I don't know that really characterizes the editorial board of the New York Times. They may have slipped somewhat, but they also published recently that the article about President Nixon starting the war on drugs, and privately
Yeah.
said that pot was not a particularly dangerous substance. He acknowledged that it wasn't even dangerous when he starts this war against it. So
I think there was also some testimony that they said they knew they purposely did it, for certain communities too. I think there was some.
Oh, it's done deliberately for
Yeah, no,
political
right.
enemies.
But I think they
enemies of-
came. I forgot who his They came out and said there was actual a quote. I forgot it.
Yeah, that was.
I mean, the Haldeman's
was it
saying that
Ehrlichman?
Oh, yeah.
Yeah.
Yes.
we couldn't be against blacks and hippies, but if we
Yes.
were against drugs and marijuana, it would amount to the same thing.
Right. Exactly. Yep.
Mhm.
We would be targeting the same
And-
groups that we
Right.
disagree with.
Alderman. Right.
Yeah.
And they hated jazz.
And marginalized
Yeah.
groups around the world have paid the price since.
Right.
But we, there was progress made also in the legislature just yesterday on the psilocybin bill.
Yes.
S-2283 that passed out of the Senate Budget and Appropriations Committee, 12-0. So that was a wonderful vote.
I think there was one. No, you might be right. I thought there was one abstention.
I think there's the one extension, yeah.
Yeah.
But
But-
that's okay. It's still 12.
Yeah. No.
12-0, yeah. And
Yeah.
it
Well,
passed
it-
in the, back in June, it passed out of the Assembly Health Committee. The bill is ready to go up for a vote.
Senate review.
Yeah.
Senate review. Yeah.
And
Yeah,
being
it's-
as it
It's looking good.
sponsored by
Scutari.
this Chairman Vitelli and Scutari.
Bartelli's right, and there's someone
Now-
else too.
You
This
know,
is
it-
the
it's-
amended bill now?
Yeah.
I support the bill, and I like that it doesn't have to swim upstream,
Yeah.
Yeah, it's a good. It's a
It
good.
should be that easy, because having had the discussion so easily in committee opened the door to real information that was then adjusted. Maybe everybody shouldn't grow their own. Okay, then we
Right.
made the adjustments, and then said, look, if it's not going to be perfect, we'll get on it. And that's the way it works,
Right.
which is, of course, on the other hand, the subject of my ire, how important it is to have an informational hearing
Right.
and to block one for anything having to do with healthcare needs an explanation rather than silence. So
You're
it's
right.
good to see that it can be done on something that runs parallel course.
Right.
Shows the dichotomy, is that the right word? Or that, somebody's coming in second.
And so
Yet I applaud the passage, this therapy.
Mm.
The more I think about it, it seems to me that with all the therapy that does work, it takes time for a breakthrough. All this time, it apparently it can really shorten that time period to where you're making progress, and just based on that alone,
And
has
and
to
it
be
had-
looked at.
and it has good bipartisan support as well.
Yeah. Healthcare bill. Everybody needs healthcare, Republicans and Democrats.
Yep.
And Conaway, I was kind of surprised that Conaway was a sponsor of the bill in the Assembly, so the identical bill in the Assembly.
Yeah, he had some concerns too, though. On some
And home grow was one of them.
Probably took out the home grow, yeah.
That the home grow, yeah, he had a few things that had to be addressed, but they were, and that's politics,
Yeah.
And he's moving on to Congress, I think, or something, whatever.
Yeah.
He
Whatever.
hopes. He hopes.
Yes, he hopes, right.
Good riddance. Don't let the door slam you on the way out. Or you don't screw anything up at the federal level.
He's gotten enough pensions from the state of New Jersey
Yeah.
already.
And it's so interesting to watch the whole dynamics work with the different groups. I'm in that group that's helping them with all this stuff, moving the bill. And it's interesting because we're working with a lobbyist, and all these little nuances of who does what, who wants what. It's amazing, really. It really is amazing.
I don't mean to be jaded, but I'm guessing there's a little slice of the pie in there for the Treasury in New Jersey, kind of helping this move along, but
Well, you know what?
then
It's
again,
not,
I'm a little jaded, you know.
it's not like cannabis though, Jim. You know, there's not
No,
going to be.
no, I know, but it moves by us having a slice of the pie. That's so New Jersey. And hey, you know, it's a known quantity. I mean, it's sort of the playing field, and you're never going to really change
Well,
that. I mean, you know,
yeah.
you play it for what it is and
Well, I don't
recognize it.
see, I don't see how New Jersey's going to make tons of money because I mean, there's licensings and
I
things
don't
like that.
either.
Right,
But
but
then why else would they be doing it?
maybe they just want to do something good for a change.
I
You
would
know?
hear
I
that
mean,
sounded like out loud. That's pretty good. Hey, you never know, right? And
Yeah.
not
eventually
like
it
we're
could
the
be
first
like,
state to
look,
do
I
this.
just did 3 things that really benefited me, but it benefited other people too. It
Yeah.
feels good to do good things for other people. Maybe they've made the transference by now.
Yeah, because I don't think it's a big money maker. It's not going to be retail and all that
Yeah,
stuff.
that's what makes it so easy for them, though. It's
Probably, yeah,
somewhere on
yeah.
the back end, a little something going on.
Maybe,
I
I
don't
don't
really
know.
care if it gets done and it's good for
Right, it's going
people
to
who
help
use
people.
it.
Yeah,
That's
yeah.
the bottom line, you know. I just don't like it. I just don't like somebody coming out having something washed for their efforts, whatever greenwashing or whatever washing. I don't know.
Psychedelic washing.
Yeah, psychedelic washing.
Mushroom
All
washing.
the colors. Yeah, there you go.
Mushroom washing.
Rainbow washing, mushroom washing. There you go.
Well, Governor Murphy said he was dedicating $14.5 million in new financial grants raised from the cannabis tax revenue. And that's going to
To
go
what?
to New Jersey community-based violence intervention programs
Oh,
address
yeah.
All right.
to address harms caused by the war on drugs. So
Okay.
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 sounds good.
Oh.
Matter of fact, I toyed with the idea of even submitting CMMJ for a grant.
You should.
They are, they're looking for organizations to distribute this $14.5 million, and it needs to be a community-based violence intervention program. Well, making cannabis available in the community is reducing violence. You're
You don't have to talk us into it. I say go for it.
Yeah, go
Having
for
us
it.
for a vote here.
I say we put together a group to go around to different veterans groups and offer medical marijuana information.
Education, yeah.
That way we're helping with PTSD victims, and that's community violence right there.
Harm reduction, yeah. Let's do it.
right.
I want to know where all the I want to know where all the opioid settlement funds are going because New Jersey got there's $1 billion, 1 billion from what I understand from the Sattler family and all that stuff.
Mm-hmm.
Probably went to Suboxone. Who the hell knows?
Also in the legislature, there was the New Jersey Assembly Oversight Reform and Federal Relations Committee held a hearing on town cannabis problems. But Bill Caruso said that New Jersey has a model that has lifted up racial and social equity better than any other state in the nation. But it's downright difficult to operate a profitable business in the cannabis industry. It takes significant financial investment. From the New Jersey Canna Trade Association, Todd Johnson said, and most small businesses fail within 10 years. So I think, we're going to see a lot of disappointed people in the new cannabis industry and people who lose a lot of money simply because
10 years, 5 years.
It's happening out west right now.
Yeah, it is.
I mean, you got families having to burn their crop because they can't bring it to the market. Not going to make enough money what it costs to grow it. And that's been going on for over a year now, though, for a couple of years, I guess.
It's not an easy business.
No, it's not.
You got your big MSOs dropped a ton of money. That's where this scheduling bit would be a blessing for them because they're just going to get swept away with the industry.
Mm-hmm.
But that's another story.
Yeah. So, yeah, I know that one of the Trenton cannabis businesses had to lay off all his employees already because, he just couldn't compete with the illegal market. And so what Trenton did was they passed a law recently, a municipal law that said that they were going to crack down on illegal cannabis businesses in the city of Trenton so that people will not harm this emerging industry. Ed? Ed, you have your hand raised? Ed, you're muted. Ed, you have to unmute yourself.
I know I'm trying. I'm sorry. I just mindlessly clicked, but I was going to say, are we serious about applying for this grant?
Yeah, why not?
Okay, then we need to see the particulars on what they expect us to do. Can you
Right.
reference it or send it around so we see if we can fit in? Because we're probably not the kind of community group they're looking for.
No, we're not. We're not, of course.
We can hold a weekly yoga session with meditation.
Why aren't we the group they're looking for? Can you,
I think they're looking for more of a a church group, some community group active with working with people. We're helping patients. I mean, they're
Oh.
people, but let's see if we can fit
Okay.
in. But can you send around parameters or whatever they
yeah,
listed?
we have to read the grant requirements to see. Yeah.
Hold on a second.
Chat's no good because it disappears.
You have to. Yeah, you have to email it, Ken.
Yeah,
if
thank
can.
you.
So putting it in the chat doesn't help anybody? Is that what you're saying? Maybe
Doesn't help
not,
me. Doesn't help me.
It disappears right away when we're done.
not if you copy it and paste it and
Oh, you're asking me something way above my Luddite ability.
Way above my pay grade.
Yeah, I can't. I'd screw up the whole thing trying to do that.
You could email it. Yeah.
wait a minute.
Okay.
You don't have to do it right now, Ken. You can do it later.
Well,
There is a link to it. All right, there's a link to it. Okay, right in the agenda that I sent around to everyone, and everyone has a copy of the agenda. If you
Okay.
just click on the Community-Based Violence Intervention Program, the CBVI, that takes you right to Governor Murphy's announcement about this with the requirements, and all the information has already been sent around to the board. It's been sent around to thousands of people. It's on Facebook. It's all right there if you just want to look at it.
If I may enter for a point of reference here, please. Community-based violence intervention programs are a localized approach to preventing violence by identifying individuals with the highest risk of violence, providing support for those individuals, helping people cope with trauma, and building capacity to resolve conflicts in healthy ways. I don't see where that fits into our mission right now. However, it doesn't mean we couldn't mold something to fit that.
Isn't that what the state does back to its constituency now and then, mold something to what they would expect, and then you find out it's not quite what you thought when you get there? I'd like to run that one back at them myself.
yeah. It sounds.
You know? I mean, oh, I'm sorry, were we accidentally misleading? My bad.
Yeah. And if you don't, all they could do is say no. You gave it a shot, and they said,
Right,
say no.
The New Jersey CBVI program supports nonprofit in the development and implementation of violence intervention and prevention programming for communities impacted by higher than average rates of violence, with a focus on gun violence.
That's going to be a tough one.
Hey, our office is in Trenton.
Well, maybe we
We
can
got
arm
a
our
geographical foot.
You got
Holy crap, my thing just disappeared here.
a satellite in Newark.
Yeah.
God.
It's a New Jersey-based program.
Yeah, it's all right. Well, it was an idea. I don't know that it's a workable idea, but
I
something.
vote you do it. I vote that you do it.
You vote that I do it. I vote that you do it.
Yeah.
Yeah.
I mean, I wrote for the first two grants I wrote for. We got the second grant, and that allowed us to hire somebody. So I thought, wow, this grant writing's pretty easy. But
Oh,
then I
No,
wrote
it's
for
not
about
easy.
then I wrote for about 20 more, and none of them were approved. So,
Yeah. Let's go 21.
and actually, we paid to send Mike Brennan to a grant writing program.
that's
Oh,
what I paid for, got reimbursed. And what programs do we want? I mean, I could see having, like going back to a conversation earlier with the email, a good project to fund.
Yeah.
For instance, the website. You know, how much to have a marketing company? What kind of budget do we need to have a marketing company provide us with the website and the training to back it up? So therefore, we're not dependent on volunteers who come and go, and our website comes and goes with them. You know, having a discussion on what is our budget to do something like that, and then we can actually write a grant towards that, and then start submitting, seeing about getting getting them filled. What other projects do we need?
Well, right now we have Lefty Grimes here if he's out of his car yet, and Lefty just spent a couple of hours working on our website, the new website, not the CMMNJ, but the cannabis, whatever.
Yeah, good luck. We'll remember it. We'll get it together.
Lefty, are you here? Are you back out of your car yet? You can tell us what you've been
Oh
doing.
yeah, I'm here.
So how's that?
Yeah,
going?
I worked on the one site. I got it, so at least it's in English and it's all your stuff and not some fake stuff. So at least it's all you guys. But the cmmnj.org is I guess you have to do something to get that back.
Well, that's through GoDaddy, and then the other site is through HostGator. The site that you're working on is through HostGator, Lefty. So I think what the idea was, I guess we're trying to train. We already paid like a couple $100 for this HostGator site, and I think the feeling was that we were trying to transition out of GoDaddy because it was a pretty expensive proposition to keep up with it. But anyway, that's kind of where we are with it. What do you think would be to bring this site to a reasonable quality? What do you think it would take, Lefty?
I think GoDaddy is actually easier. It's more user friendly, and I mean, if Nick or somebody else wants to, get involved, it could be something that it could be updated all the time. Because I update my GoDaddy site all the time. It's very easy and user friendly. WordPress is not so easy. I was able to get through it, but it's not. There's more you can do with WordPress, but I just don't know how to do all those fancy things. But GoDaddy actually has a very good choice of things you could do, even though it is expensive. I know we have one for Sativa Cross as well. I got rid of the WordPress site we had.
Really?
I didn't care for it. Yeah, I didn't care for it.
Huh. Everyone told me that the WordPress was easier, and actually GoDaddy has a WordPress site or you can convert your website, I understand, to WordPress on GoDaddy itself. So
that might be something to look into. Maybe merge them onto one or the other.
Yeah. So we'll have to talk.
But I can work. I can work on the other one if you want to, the CMMNJ, because that's actually dead in the water. There's nothing there at all.
Right. I don't even know how to get it back, quite frankly. I don't know. Have you been able to actually even get it back so that you could work on it?
Well, I would need the GoDaddy password then, because I have the HostGator entry portal, but I don't have the GoDaddy, so I'd have to go in through that.
Okay.
So I'll have some time this week to take a look at that too.
Okay. Let me make a note of that. You need the passwords. All right.
What the hell happened that you got time for anything? You're the most, I don't know how you make time for all this, but appreciate you doing it though,
It was literally 2 hours last week. I spent 2 hours on it last week. It was not a big deal. My free time while I'm rolling a blunt and smoking the blunt and Maybe I have the assassination of Malcolm X on Netflix next to me. That I'm watching that, or something, something, and I'm working on stuff.
Now I feel totally inept at it, inferior. Thanks, bro. Now I'll mute myself and
I
sulk.
watched Beetlejuice today, so yeah, I go back and forth between good stuff and crazy stuff.
Oh, the new one or the sequel or the original?
The new one, the new one.
I actually like the new one.
It's wonderful. It takes me back. I wish they made it 20 years ago. They should be on part 4 by now.
So I did make a note that your ignorance is no excuse tour with Gary George. There's a link to that, Lefty, in our agenda. So
yeah, that was a good one.
Mm-hmm.
It was.
Okay.
Man has some energy, I'll give you that.
Okay, and I had a letter to the editor published in the Trenton Times entitled "Allow Medical Cannabis in Healthcare Facilities." And right after that, Senator Timberlake introduced a bill S3332 that would create a 5-year pilot program to use medicinal cannabis in university hospitals to evaluate its efficacy in improving patient outcomes, do research, and spark innovation in medical cannabis. So, and I got an email about that from the gentleman who's the Director of Policy and Legislation for the office of Senator Troy Singleton. So, got some notice and got some action. Got a bill introduced at any rate.
Good deal. Good work.
Right.
Well, wait, would we support that bill? In a way, it's such a tiny little thing. Is that set us back for saying we want it in all institutions?
It's a
Well, we
step
want
forward.
all institutions anyway.
Huh?
They're not, what do you call it, mutually exclusive.
Right,
They can
right.
have their pilot program, we go for the whole, well, we go for the gold.
See what I was worried about, the more, Jim, is they say, oh, we've got this pilot program and we'll let you know in 5 years,
Yeah, I worry about that too, but that's when we need to be
But those
forceful about this. We can walk and chew gum here when people's lives are at stake.
And those pilot programs, they have a timeline in milestones too, so you would know. It's not going to. If it should say in the pilot, it'll take 5 years. If it's going to take 5 years.
Well, let's go for a concurrent sentence rather than consecutive here. Oh, sentence, did I say that? You know what I mean.
Right. But what I'm saying is when they put those pilot programs out, they usually have a timeline.
Yeah.
Yeah. So, I mean, it would be wonderful just to get medical cannabis in a hospital in any situation, but
oh yeah, absolutely.
Getting it
really?
getting it in all state institutions where anybody who qualifies for it and could be and is suffering from a condition that qualifies and has a recommendation for it should be able to get access to it. It would really improve.
I think it could really it would also point to the fact that it is a great step in the right direction. It can be done, and then while applauding and encouraging it to be the best pilot program it can be, it kind of demystifies it. Like, well, actually, waiting 5 years to do next step would be an injustice. I mean, it may start to show
efficacy,
not real proof, but evidence really quick. And then what? I mean, so it will stir.
Yeah, they're looking mainly for safety and efficacy with stuff like that. But in what form of administration? Whether they're talking pill form, I'm assuming.
Oral. It'll be oral.
Oral, yeah.
Yeah, most likely.
Too much with the smoking laws and considerations, and especially with oxygen concerns and
right,
and topical,
yeah,
topical, yeah, rectal,
or both. The balm that I use is the best balm ever, and then when I use it and make cookies, it's really good cookies. So how lazy I am. I just take a fingerful. I don't feel like making cookies yet, and Have another fingerful, and it becomes literal potluck, but you kind of know about where it is. I mean, so yeah, I could see that going over pretty big in an institutional setting. And I think the staff at least would see real quick the benefits in
And,
all sorts of ways besides what's going to make the notepad or the chart.
and that's the great thing of it, is because the data will show it, and it'll be so irrefutable. The same thing like with the ibogaine research we want to do, that the results are going to be so,
Yeah.
if it's done properly under the right conditions, the results and the data are going to be so outstanding that they're going to be hard to ignore.
It's like though the stuff that'll be noticed along the way, long before that gets set in stone like that, would be, Cheryl's neurologist was the head of neurology at Paul Kimball Hospital in Lakewood. And he'd say to her, he'd look at us, Cheryl, you know how I can tell as soon as you come in the office whether you've had your green butter or not? And Cheryl would say, how? It's because you start conversations and you look right at me when I'm talking to you.
Mm.
Right. What did I do neurology? Nothing. But it had everything to do with getting better,
Right.
So that kind of thing gets noticed along the way, and it greases the skids for a real.
Not only does it get noticed, it gets categorized and data collected, and you can measure it scientifically.
Ed, what's on your mind?
Okay, back to this bill. I mean, it seems we in CMMNJ seem to be, we deal with a lot of bills people introduce in my group, but Common Interest Coalition, we have to write all the bills, and so we put in anything we want. And I'm wondering if this is just in a bill form, we can suggest something. I'm trying to think of some way to modify this bill to say, okay, you got a pilot program in some universities, but let's include some public hospitals too. Let's expand this pilot program,
Well, that all depends on how many patients they need in the study and how many research sites they need. They figure all that that gets all figured out. So, to make a statistical significance and all that stuff. So that has to be all figured out. You might only need 10 universities. Maybe you need 20. Depends on how many patients you want in the study.
But see, I'm trying to expand it beyond just universities. We'd like it in all hospitals,
But then I think there's a certain criteria for what classifies as a pilot and then a full study. So you just got to figure that out. I forgot. Maybe a pilot's only 5. Maybe a pilot's only 5 universities and 75 patients. Got to figure out how they're determining what a pilot is.
Yeah. And also there may be more resistance, or it may be easier to get it into a university affiliated hospital rather than.
And then you're talking budget wise too. It's cheaper to do a pilot than to do a major 30 site study.
Mm.
Mm-hmm. So State University may have different avenues available that other institutions would not.
Right.
As far as the separation of federal and state, with cannabis laws.
Right.
And
there might
seems to be the big blocking point there.
There might be insurance things to consider too. A private institution versus a state institute. It might be some insurance issues there as well to consider.
Yeah, but so are we. We're not unhappy that they're pretty much putting institutional hospital use on hold for 5 years.
Well, who said that? Wait, why was he throwing
we're
around
still working on it, Ed. We're still working on it. As a matter of fact, I have an op-ed that is ready to go for implementing the institutional caregiver. That they're not mutually exclusive at all. So,
but I think they are in hospitals, Ken. If they're going to say, "Look, this is our hospital study," maybe other institutions like nursing homes, maybe, or prisons. But I'm afraid hospitals they're gonna rely on this pilot.
Well, not the hospitals that don't have the pilot program in. They're
right.
You're only talking about a couple hospitals in the state of New Jersey that are university hospitals that would potentially be part of this pilot program. So
We can
the other
make that
hospitals
clear.
and the
Yeah.
other healthcare institutions, you know,
Or private,
yeah,
Hmm.
well, even if they're not private, they could be,
right?
they could certainly implement the institutional caregiver. In fact, there was a New Jersey Cannabis Regulatory Committee virtual roundtable, which an invitation was required to attend. The one on September 25th had to do with the number of ATCs, alternative treatment centers, in one committee. But the one on October 1st with the permitting and licensing committee was discussing institutional caregivers. Now, I applied to be, to testify at that committee, but I wasn't granted. They didn't accept my application to testify on October 1st with that committee. So and not only that, but the committee hearing was not available online so that you could even hear.
So
That
so
was
who did they pick to testify?
I don't know. There's no indication of who they did pick to testify. And this is one of the things that I'm going to send to the regular Cannabis Regulatory Commission at their next meeting. My written comments are going to be what happened here with the institutional caregiver. Well, is that committee testimony available somewhere? And the next committee meeting, next meeting of the Cannabis Regulatory Committee is Thursday, October 17th. So I've got a little work to do ahead of me.
Do they put meeting minutes out for those other meetings?
Ken?
Yes, you can go back to all the other regular meetings, but not this not the virtual roundtables that they have. I couldn't find them anywhere on the CRC website.
Yeah, I got invited by Krista Nash that morning. She sent me a personal message asking me if I was going to participate in a roundtable that morning. And I had mentioned to her directly that you had submitted, and also Peter, if I'm right, testimony for it and weren't chosen. And she had called me back later and told me she wanted us to be involved in this. However, we have to request to be invited. And I'm waiting for an email from her staff to explain exactly what that means.
No, it was quite clear. We did request to be invited.
It didn't get picked.
There was a link on the CRC website that said, "Here, request here to be invited to this committee meeting," and you must have filled it out if she called you, Mike.
Yeah, I guess so. I'm trying to. I mean, when she reached out to me, it was that morning, and like I said, I referenced back to what I said earlier with you and Peter at both.
So you did not appear. You did not take the opportunity to testify at this meeting.
But
no,
was she calling you? What was she calling you for? To testify?
She had asked me if I was going to be testifying later on that day.
Well, then you should have said yes.
Oh yeah, Mike.
What were you thinking?
I wasn't prepared.
You weren't prepared
for
to
what
testify.
she had,
Right.
I could have taken Ken's testimony and just presented it.
Yeah.
But again, it caught me off
Off guard.
I just responded honestly, and I wasn't prepared.
They should give you. They should give you more notice than that.
Yeah, they really should.
That's ridiculous.
All right, Ed, what's up?
Okay, at the risk of beating the dead horse on this pilot program, can you just send me a link to the bill number? Because what I would like to do is put something in the bill that says, the conduct of this pilot program shall not inhibit, institutional use, should the law permit it in other institutions or whatever, just something to, because I really am afraid that they're going to use this as a block for any advancements in institutional use in other hospitals or anything, saying, "Oh, we got this pilot program. Let's do data and studies up the wazoo."
I couldn't
patients
agree
need to have their
more.
marijuana now in hospitals,
Yeah.
right?
Hold on. I'm not understanding what you're meaning, Ed. How are they going to use it to block? I mean, first of all, another institution could block if it's a private institution, right? I mean, that's like work at will. So maybe I'm not following what you're talking about.
Okay, because apparently they want to let a couple of university hospitals allow patients to use medical marijuana, right, while they're being treated for other conditions.
Right, for a pilot study. I got
Okay,
that part, right.
Okay, and me too. But I'm thinking we want this broadly allowed in hospitals throughout the state. So, like I've heard all the patients say, I go to the hospital, I can't use my medical marijuana. They confiscate it, and now I'm in trouble, you know?
Right, but again, not just like the opt-in, opt-out thing with the municipalities. Not every hospital you could do it that way, but not every hospital has to accept that, right? You can't force them to.
I can clear
accept it.
this up, I think.
Okay, good.
Ed wants to make sure this doesn't preclude other advancements in that area, plans, studies of whether it be other hospitals it would preclude, but not other facilities, In other words, that does need to be cleared. I absolutely, and I'm thinking not, but I'm thinking not. This can be ascertained beyond a shadow of a doubt by whoever would be able to clarify that. So I think it's well worth making sure that there isn't any way this is going to preclude additional advancements working concurrently rather than consecutively.
Right.
It seems to me, but in a layman's understanding, that would make no sense at all, especially in a healthcare issue. It's sort of like, we got vaccines in a pandemic by going off in all these directions and see which one went first, not waiting to start the next one. So we know when it's important that we shouldn't stymie something by a pilot program that's going to start to show advancements, but we're locked in 5 years. I don't see how that could possibly be, but I want somebody that has.
I'm confused because
Don't worry about it then.
Well, let me
What I
read
do
it.
when I'm confused.
A pilot study. That's what it is. It's a pilot study. So then you can later on expand it. And again, I keep hearing this 5 year thing. Let's read what the pilot study says. Does they 10 sites 1 year or 5 sites 2 years?
And then ask the person who would know the answer rather than beating it around ourselves.
Right, exactly.
Let's read somebody who has a definitive answer. We need to know who that is and to make sure that they tell us what it is.
It's Ed. Ed's the one that brought it up with the pilot study, so he's got to have that somewhere. So I'll read it.
No, it's in a bill. I understand. Ken, can you just send me a bill number?
Ed, if you already have that right in your email, right? It's on Facebook on the agenda. It's on the email agenda.
Okay, it's in the agenda. Okay, I'll look at it.
3332. You have it. All you have to do is click on it, and it opens right up.
I'm with you, Ed.
And if you want to suggest a sentence in it to say that this pilot program will not preclude the implementation of institutional caregivers in other healthcare facilities, that would be possibly a wonderful addition to it that no one would object.
Yeah, thank you.
Thank you.
That's what I'm looking for, that they don't use this as an excuse to stop everything for 5 years.
Okay. All right. Well, good. Then write that sentence and send it off to Senator Timberlake regarding S3332 that you have a link to.
Ed, if you want me, you could. I'll look at it too if you want me to look at it.
Please, Gaetano, please.
Yes, I will.
Because you're a technical guy. I'm just thinking legalistically.
Right. No, I know. Listen, I'm not technical. I know a little bit about running studies, so I just want to take a look at it and see what the heck's up.
Okay, good. More eyes, the better.
Okay, so we're still on the Cannabis Regulatory Commission now, and Governor Murphy replaced NJCRC Commissioner Charles Barker with Amelia Mapp. Now, Barker was kind of controversial. He was I don't know, he seemed like a good commissioner to me. But we don't, and Leo Bridgewater came out like really strongly that
he was
condemning this replacement, but we really don't know what was behind it. So, I mean, I don't know.
Is it a
what was behind it.
Should it be a secret? I mean, in other words, it's a logical question for everybody. Why was this move made? I mean, it's the first question anybody would have. So is this going to be another secret where we're not allowed to know why
Don't it,
something
it
happened?
isn't it like that work at will thing? Aren't you? Don't you serve at the discretion of the governor?
Yeah.
Right.
That was it. They're all
Well, then somebody should say so.
chosen positions by the governor.
Right. So right. That's like that work at will thing. You know.
Well, then maybe
Um,
the governor could answer that question.
Or
Is
we
this
could, I mean, we didn't hear anything from Commissioner Barker. It didn't sound, I mean, we didn't hear some outrage from him
Well,
about why you're
yeah,
doing
because sometimes it's in your contract before you even take the position that you can't do this, that, the other thing. Maybe you can't say anything either without getting sued.
NBA? Yeah.
Yeah. So who knows?
I heard something about that.
Oh, there you go.
I heard that he wasn't supposed to get that position in the first place. It was promised in the beginning. They got a certain amount of picks, and one of those picks was supposed to go to the ACLU, apparently,
Oh.
and it didn't. So they had to correct that.
Well, I think Booker had a lot to do with because he was on Booker's staff. Booker had a lot to do with getting in that position. No.
Yeah, I don't know about that. I just know that just what I heard, and I'll tell you who I heard it from offline.
Okay.
And they replaced her. They replaced him with I forgot her background.
The mayor of Plainfield's wife.
Right. Yeah. That's her background.
That's right, Mrs. Matt.
And Mrs. Mapp. Yeah. Yeah, but I forgot she has a background in something. I forgot what it is now. Yeah, Leo was pissed. I caught him on Instagram a couple of weeks ago. He wasn't happy.
Yeah, there was a big article in New Jersey Cannabis Insider that it was all about Leo's,
Yeah.
outrage and
Opposition. Yeah.
that, apparently, well, he was the only black male on the commission.
Yeah.
So, that hurt from a racial equity perspective. Anyway,
He spoke up for Zoom access. He spoke up for Zoom access for disabled vets. He spoke up for wheelchair access to dispensaries.
Yeah.
Disabled vets.
And what is the first lady of Plainfield qualifications?
I forgot what her background is. I did read it somewhere, and I just totally.
I think I did read that she was supportive of cannabis reform, but
Yeah, but what does she know about it? I'm supportive of it too, and I wouldn't belong on the damn committee. Need a little more than that. Well, I guess you don't, because you don't need it, The back room doors aren't even closed anymore, and it still doesn't matter, To get good ventilation, open the door, nothing they can do.
Yeah. The medical panel, what were they called at the CRC? All the doctors who got together to decide about whether or not they should add qualifying conditions. I've researched all their backgrounds, and not one of them had any, published works about medical marijuana. None of them had any seminars that they attended about medical marijuana. None of them had anything on their CVs, and they had very extensive CVs published.
Well, none of the legislators that organized the original conditions had much of an idea what to do either. I mean, that started out on the wrong foot, Well, no, we don't want to leave it up to doctors. It's a medical program, but we're going to decide. And then, I'm glad that they at least did get to add in conditions and, didn't make it overly.
Yeah, actually, they did a good job.
And that was.
Yeah.
That process worked out, and I suppose adds a little credence to the fact that, you can fix something once you get it passed and,
Mhm. Anyway.
But the sooner you get it right, the sooner you get to that, and the sooner you have a damn hearing, you get the right information to get it right. See how I always work back to the hearings?
Didn't notice.
So moving along, to federal drug policy reform, the DEA is going to hold their administrative law hearing on marijuana's scheduling on December 2nd, 2024.
It's a 3-year hearing, though.
Yeah.
It begins then.
I don't think anything,
I'm sorry.
I don't think anything, and then they've got to evaluate the hearing. So Normal is going to be testifying at the hearing, so that's good because they testified at the original hearing in 19. Well, they applied for the original hearing to reschedule marijuana in 1972, and it was finally held in 1984, and anyway, or 86 rather, 86, and then they won that hearing, but the decision was overturned by the DEA administrator in 86, and marijuana remained a Schedule I drug. So their testimony should be interesting. I did not apply to testify at the marijuana scheduling hearing, administrative law hearing. Although I have testified at a number of administrative law hearings in the past when I worked for state government. But one good thing was that the DEA did acknowledge that there is a new 2-step test for marijuana's accepted medical use, and that it's legitimate because the DEA in the past had created this 5-part test that was, quote, impermissibly narrow, which made it basically impossible to reschedule marijuana with their 5-part analysis. So that one of the things was that it had to be able to chemically reproduce a plant without using any plant material. I mean, it was just impossible to do it with marijuana. So, but the 2-step mainly only says that marijuana is used in a number of states and is recognized as medicine by a number of physicians and
professionals.
Professionals. So it's a much friendlier analysis, and it's almost certain if the DA does accept that 2-step analysis that it has to be rescheduled to a Schedule III. That's the good news. The bad news is that some of our friends in Massachusetts and other places like Shalene Title said that reclassifying cannabis as a Schedule III drug only exacerbates a bad situation. It embeds it in the deeply flawed American pharmaceutical system that ignores the cultural and spiritual practices that have long been a part of cannabis use. So making it a Schedule III is a double-edged sword in a way. It's going to make it easier to do tests on it. It's going to have them legitimately acknowledge that marijuana is medicine, and that all the people who've been using the word medical marijuana in quotes have to remove the quotation marks because it'll now be an accepted medicine. But on the other hand, it's probably, well, I don't think that they can really undo the state programs, even if they acknowledge it's a Schedule III drug. I think that that's going to be in addition.
Too far gone. Yeah,
it's too far gone.
Too far gone. And I've said it before publicly too. There could be multiple lanes. I don't know why people get so upset over this big pharma thing. The big pharma is going to carve out their lane. End of story. It's going to happen. And then there could be other lanes that could coexist.
Yeah.
I mean, I don't get why everyone gets so upset. There could be multiple lanes.
Right. Yeah, I think you're right, Guy.
So what's wrong with multiple lanes of descheduling that?
Mike, I agree with you. Mike, I agree with you 100%. But that's not what's happening right now.
Right. Right.
Deschedule everything.
I agree.
Deschedule everything, but it's not happening.
There were some that said even back in 2005, when we had a law introduced, it should be legal for everybody, not just patients. It should be legal for everybody. But we didn't wait on them, did we? Yeah, it should be. It should be. Oh, it's a weed. It should be treated as such, but it's not. And I'm always gonna say, patients into the lifeboats first. And if there's not enough lifeboats, good luck. And it's they it can I like that there are bills for adults only, patients only, and both.
Right.
They're not mutually exclusive either.
Right.
Thing is, people don't seem to be working on the adult bill as much as they are on the patient bill. Adults don't seem to be really like, I mean, most people don't even know there is an adults only, a both bill. There's a lot of people don't know that when I tell them that. You mean there is one? Yeah, there is one. So, I don't, this is all on the back of patients in the first place, in my mind. And, where's the legacy benefits for them? How you have a social equity program. Okay, what's the parallel thing for the people that were harmed and didn't live long enough to even see this happen, Yeah, it should be. We should all be helping patients and then deal with the rest. In my humble opinion.
Jared said BRB.
Be right back.
Oh, be right back.
Oh,
okay.
Bring real bottle.
Okay. Any more discussion on that? Federal Advisory Committee from the National Academies of Science, Engineering, and Medicine called for a public health approach with the Centers for Disease Control and Prevention, CDC, taking a larger role in cannabis policy. An estimated 18 million Americans use marijuana daily or near daily, more than the number who drink alcohol that often. That's pretty remarkable, I think. We marijuana consumers have passed alcohol consumers, or at least equaled alcohol consumers in America.
We've brought a few over. We've converted a few.
Yep.
And one doesn't preclude the other.
That's true. Well, they
I
say
enjoy
it's like drinking alcohol and smoking cannabis is like pissing in the wind, but sometimes you have to do it.
Oh,
Piss into the wind or get arrested for exposure in public if you go with it to somebody over there. I could get that one by in court. Yeah.
So it'd be great if the CDC gets involved in it. And the Marijuana Policy Project has a very good federal marijuana policy and pending legislation. All the pending legislation on federal marijuana policy, if you're interested. All you have to do is click the link. So recent events, New Jersey Cannabis Conference 2024 in NECANN. So we have some people went to NECANN, Mike Brennan, who else? Anybody here? Guy was there.
Alicia, Jeff, Michelle.
But they weren't
But
representing.
they weren't part of our group.
They
No,
weren't part of
just
CMMJ.
Me and Felicia, and then I had Andy Walker, Scott Kohler, and Wednesday Mayer
Nice
volunteered.
Mm-hmm.
Yeah.
Very good. So you were talking about sending out some kind of fundraiser to the people that you contacted, Mike. Anything happen with that?
Yeah. No, but there was something else. I before I forget, you had received a letter. Inadvertently, John had taken your business card and assumed that he was talking to me in Atlantic City.
Okay.
He assumed it was Ken Wolski. So, but to get back off of that for a second. Oh, no. I had gotten the email addresses merged, and then I need to sit down and send the letters out. I've been pretty much trying to stay out of the hospital for the past 2 weeks. So that kind of went to the side there for a little bit, getting that out. But now what that was I sent you a copy of the letter as far as the ask, and now's the time to send it out. Again, there was a bunch of names that I did have from down there, and we can send that letter out to any other list of people we have.
Well, part of the letter is,
If you want to merge it with the list that you already have, I'm saying go right ahead.
I don't have the list of the addresses that you compiled a list of the addresses. I mean, that's how a letter
Yeah,
was.
there was a yes, the list of addresses. I thought you had sent them to me, or did Andy send it to you? The addresses from the clipboard.
Right. Yeah, I
Was
don't have
that-
them in electron. They were supposed to be made into electronic format.
Right. And what I did was I took them and I pasted them into last month's newsletter. So everybody that was on that list got a copy of last month's newsletter.
Okay.
Okay, so I assume that wouldn't that include that list into this month's mail?
Yeah, if you put them on the if you added them to the GoDaddy list.
I think so. I thought I did, unless I ended up sending them separately myself. Maybe I did do that. Anyway, I'll send you a copy of the list. Don't worry
Okay.
about it. Maybe you can put it in yourself.
Well, what we're looking for are the physical addresses. If we're going to send a letter, we need physical addresses.
Right. No, here's where it's an email, sending them out to the email address, because that's what we have,
Okay.
is the email
All right.
address. And we'll send it out and they can respond back and we'll get started from there. But the whole thing was set up to respond to the email addresses that we have. At least that's what I intended it to be. I don't have physical addresses, to be able to send out an old stamp and envelope campaign,
Right.
fundraising campaign.
Right.
Yeah, no, I was looking at this as a email campaign.
Oh, I thought we had talked about sending out an envelope and then with an enclosed envelope.
Right. Well, we don't have physical addresses for that.
Okay.
So
we can't
what
do
they
that.
can do is, the link is in the letter, so that would just go right to our donation link.
Okay. Yeah, we're trying to
Yeah.
think of some way to recoup some of the expenses that were associated with the
Right.
Atlantic City
I think it's
event.
something that should be
Well,
not
like-
just that cost, but the cost of what travel around to the different conventions and our regular routes that we do across the state should be something that I don't know if we budget for it for next year. It ends up being an item because what we paid for it this year ended up being pretty much close to what we paid before. And I found out that we can reduce the cost of what we're doing down there, which is, I didn't realize we had 2-bedroom units available to us.
Yeah,
before.
no, we paid twice as much this year as we did last year for it. We paid
Yeah.
like $766 for it for the rooms this year. And it was about half that last year.
Okay.
But yeah, we could have used one room. If it had 2 bedrooms, you could add the women in one and the men in another.
Yeah.
That would have saved
And-
a ton of money right there. So
And that was inadvertent that they brought it to my attention when I was there signing in.
yeah.
I didn't realize that. Now, again, looking at their website, that there was 2 bedrooms as an option.
Yeah, well, we'll have to check that because I have to make a change to our treasury report on the agenda. I said it was 10,500, but after paying the Amex bill, now we have $9,717 in our treasury. So anyway,
Okay.
all right. And but you made a lot of good connections in NECANN, and it was a very positive experience.
I think we've got a good place there to work from. But again, it's having having the volunteers there freed me up to get to go out and actually meet people.
Mhm.
Because remember the one year that you and I were there, we were stuck at the table the whole time because it's just you and I.
Yeah. Yeah.
And you end up not getting any networking done,
Right.
or even getting to the different talks that they had. Because we were just stuck shaking hands and giving out information.
Yeah.
But if we plan this ahead, again, having the volunteers freed up so that, last year I could speak, be a speaker there.
Mhm.
And this year, again, I got to go out and do some more,
Were
getting
you
to
a
know
speaker
some
this
other
year,
people
Mike?
there.
Mike, were you a speaker
What's
this
that?
year? Were you a speaker this
No,
year?
that was not this year. We got between the handoff. Apparently, this year they sent you the email with the registration, and by the time I got it, the window is already closed for the
Oh, yeah.
speakers.
All right.
Yeah. So,
Right. Guy,
yeah.
how was your experience down at NECAN?
Can you hear me?
Yeah.
There you are.
Yeah, no, it's always good. I network and so on. So and I always make out well at those events.
Okay. Ed, you had something on your mind?
Yes, on the fundraising, were we thinking of sending out like hard copy letters and asking for envelopes to mail back checks or something?
Yes, that was what we were thinking. Yes.
Are we available? Can we take Zelle?
Yeah, or PayPal, or yeah.
Yeah.
It might be easier for people.
Because I mean, I'm a sucker. I mean, I've been given to every Democrat in the country, and when you click on it and it says, "Oh, PayPal," it's like, okay, I got PayPal. Here's $15, because it's easy for me. I don't have to give them a credit card number or anything. And if you want to encourage people to donate, the easier it is for them to do it, the more you get.
We have not only a PayPal account, we have a QR code that leads right to the PayPal account. So I mean, I sold one T-shirt at I think it was the Happy Wellness Expo that I went to on September 8th at Fairleigh Dickinson University, and like the one T-shirt that I sold, the guy just went to the QR code and said, "Okay, there's my money," and I gave him a T-shirt. So it does work, and and the QR code is right on the agenda too.
Yep.
So that easier to email people and just say here.
That's my point. That's why the link is in the letter. You saw a copy.
Except that, we've been doing it for years and it hasn't really been raising any money that way, though. That's the only thing.
Okay.
I thought maybe, we might try with a limited amount of just the people that you actually had, met and physically seen at NECAN. I thought with, maybe 30 people maybe on the list, that it might have been a nice trial experience in sending out envelopes. But that's not going to happen.
Well, the information that I got, the addresses that I did get were from the clipboard that we have on the table, which doesn't have a spot for people's physical addresses to be put on there, does it? Or maybe that's what that third column's for.
Oh, some of them do, yeah. Yeah, the clipboard, yeah, that does.
Okay.
Yeah. I mean, there's a spot if they want to put in their physical address. And a number of them did. That's why when I saw that, I said if we just converted them into an electronic format, then we could print labels, and then it would be easy to make, a label, put it right on the envelope, and then put a CMMNJ label on the envelope, and then put a internal label on it too, So it would be easy enough just to print labels, and that would be our fundraiser, and include a letter in with it. But
I used to do 10,000 of those a week in my former life.
Well, you get so many because apparently although it's a lot of work, it's an effective fundraising tool. Like Ed says, he gets them and he sends money into them. And so.
Well, yeah, that's exactly it. We made the connection at the convention, followed up with a thank you. It was nice to meet you. Well, you read the letter that I just.
No, it was a very good letter that you wrote.
Well, that's
but,
great.
Anyway.
I'll make sure I get it sent out then, or else it won't do any good.
Okay.
Sitting on my word processor.
Okay, so I did the Happy Wellness Expo. Then there was the 420 Expo that included the first New Jersey Legal Cannabis Cup in Edison, September 13th to the 15th. I was there. I helped break down on September 15th, I guess. And we had a table there. Any comment? Anybody went to the 420 Expo?
Yeah, I had two panels there on some psychedelics and other expungement and stuff. That was the first time they had that.
Mhm.
Who won the cannabis cup?
Don't even know.
I was there.
First
I
ever.
got to see the one joint rolling competition where the oldest guy there won, and then another old guy
Wow.
did some origami joints and won the talent competition with that. But that was the only part of that I got to participate or I got to enjoy.
Yeah, there was a couple hundred people on the floor, I was told, for the Cannabis Cup.
An old guy. When an old guy says an old guy did something,
That's an old guy.
that guy being referred to.
Yeah, I was there
Saying,
on Sunday.
wasn't the young kids from the what was the Spank site that they had there? No, wasn't any of the young kids that were up there rolling joints. It was the old guys that did the quality work.
I was there on Sunday the 15th, but I was there to break down. And well, I was there all day, but I was the only one there, so I really couldn't leave the table for very much. And really, I didn't make any money at all, maybe a couple dollars in donations. And then finally, there was the Ewing Community Fest on September 21st. Ed was there, and Ed and I tabled there. Ed, you still with us?
Yeah, I'm just clicking around here. I just lost my feed. I don't know what's going on with this stupid thing.
Well,
Oh, there you go. You're
But I was
just
going to
there.
say,
Anyway,
There you are.
at that community fest, Ken, didn't you sweet talk some lady said she'd volunteer and type up all the names or something?
Ooh.
I don't remember that.
Remember, like we're looking for volunteers, and some woman said, "Oh, I could type up things. I could volunteer." I thought after you took your shirt off and attracted all the women.
You showing off your tattoos again?
Yeah.
Maybe that's when they left. No.
A lot of people promise things that never come about, Ed. I don't know if
Yeah.
you've noticed that, but that does happen.
Happens a lot.
Oh, by the way, I guess we're not doing it. Isn't this weekend the Hamilton Community Days that we always have trouble with?
Oh, yeah. I don't have a schedule for any other community days, anything coming up.
Yeah,
And,
it is this time. It is this time of year. That's where I first met future Governor Christie at them, and that was when they're sitting there with Kathy and Ken. I don't know if Ed, were you there, but can't remember. But yeah, Ken said something like, "Look at that guy. That's the fattest ass I've ever seen." And, you know, I'm just making an observation, not rudely or anything. And then, you know, I looked and I recognized who he was, so I hustled off, you know, with one of those postcards of Cheryl, so I could put my thumb over there. I'm a medical marijuana patient, not a criminal. I put it over that and rushed over, and sure enough, it was him. You know, and
I got a picture of you doing that, right?
Yeah, yeah. And then wouldn't you know it was Bill Baroni showing him down, and he just broken ranks with other Republicans and supported medical marijuana based on Chuck Kwiatkowski's testimony. And that was just odd. And it was even odd for Christie because he met when I looked up and said Senator Baroni, good to see you showing him around. You know, you should have already had this talk with him. I want to explain what it was about. And he said, yeah, I know. And I said, well, you're going somewhere after this. You're on your way out. Have the talk. You know, which confused future Governor Christie, like, who is this guy and how does he know Senator Baroni and, you know, all that. But so Hamilton Fest really, you know, kind of got all that started. And, you know, I just wrote that picture of, I mean, nice picture talking to him. The one I like is a casual one where I'm turned around talking to somebody else and Governor Christie's, I mean, like right behind me. And I title that one, right behind me. I'm not falling for that old trick, you know, because it, you know, is an odd looking picture. But yeah, they didn't they didn't let me have a sign there. It said something about, I forget what. I'm walking but there was also another candidate for office of some kind there, and they had a sign and I complained. And I thought that I'd get the right to carry my sign, but I didn't. They made them not carry theirs. Well, okay. Not what I was after, but anyway, I Hamilton Fest, that always makes me smile. That's the best I've ever seen. You
Yeah, we
know?
got thrown out of there because some kid got one of
Yeah.
our marijuana is medicine wristbands.
Yeah.
And
Oh,
the mother
God.
complained to the mayor, and the mayor said, all right, we can't have kids getting marijuana as medicine wristbands. So you guys can't come anymore. But we got the ACLU involved, and
Yeah.
they said, no, CMMNJ can come to the Hamilton Fest,
Yeah.
and we're going to see to it. So then they instituted a bunch of rules like you can't walk around. Oh, and you have to have a game. If kids show up, you have to have a game for them.
Right, yeah.
So we had Lorraine went and bought I don't know, one of those beanbag toss games. So,
Right, yeah.
you know,
I
we'll be in compliance with
thinking
Hamilton Township.
We should have had a game, roll the joint.
Yeah, gonna have a game. I'm holding a number of fingers behind my back. Guess how many? Wrong.
Yeah.
Yeah.
How to clean the seeds out of a frisbee.
Yeah. Oh, you know, and that was oddly enough back in the day where what we heard most often was, got any samples? I mean,
Yeah.
it was, remember how many times we would
Especially
hear that?
there.
I have to say, ha ha, it's not
Yeah.
really funny. I mean, I appreciate your humor and, you know, but now we could say, yeah, and we're allowed to give them to you up to an ounce.
Hmm.
I mean, we would be
Okay.
allowed to give free samples for anything we did.
Yeah.
Well, we're not licensed for that though.
No, and one person can transfer, one adult can transfer up to 1 ounce of marijuana to another
Like,
adult with no money
personal,
being
okay.
exchanged.
Yep.
It's right in the
Personal,
law.
okay.
So,
If you're acting in the capacity of an individual person, not on behalf of an organization, no? Yeah.
yeah, well, I mean,
Exactly.
but if an organization is made up of individual people, so I can skate right around that.
A corporation isn't oh, wait, never mind.
Yeah,
Yeah, really.
it is.
All right, so we're not going back to Hamilton Fest.
Ah, come
Come
on.
on. Sounds like fun.
Sounds like fun.
No, they changed the nature of it too. That it's not like I forget what they did to it, but it just sounded like something that I wasn't really even interested in applying for.
Yeah.
My favorite game that I was given here as a gift is it's a whole complete game of Trivial Pursuit, and it's stoner trivia. There's thousands of stoner questions in there. You go to someplace like that, gotta have a game for the kids. There we go, stoner trivia.
Sounds like our next board meeting.
Bada boom.
No, worlds are colliding.
All right. Finally, I want to get on a little bit about home cultivation. There was a gentleman by the name of Raphael Zabala called me today, I think it was, and said that his friend Amon Hamlet was busted for having 84 plants in, I think it was Bloomfield, New Jersey, and he's looking for legal representation. So I sent that around, and Guy was kind enough to send my email to a bunch of lawyers, cannabis lawyers, And Molly Hartig got back and said she actually spoke with this gentleman, and she was surprised that he was still looking for a lawyer, and she thought maybe he was going to be he couldn't afford, whatever lawyer was referred to him. So the father of the gentleman was supposed to come on our meeting here tonight, but he didn't show up for one reason or another. So anyway, he's going to have a hearing on the 30th of October, a court hearing. So typically that's the kind of thing that probably in Bloomfield, I think it's in Bloomfield. That's the kind of thing that we used to go to and, demonstrate outside of the court hearings about the issue, that here, this was supposedly a medical marijuana patient. Now, the guy I spoke with, I don't think he knew the entire medical history of the gentleman who was busted, because he said he suffered from depression. And I said, well, you can suffer from depression, but depression itself is not a qualifying condition for marijuana therapy in New Jersey. So, it must, if he was a legitimate patient, he would have had to have, a different diagnosis or an additional diagnosis. Anyway,
But a card, he would have to have a card.
Yes, a card. But in order to get a card, you need a diagnosis that is one of the qualifying conditions. So, but anyway, I don't know any more about that right now than what I just told you. The gentleman did not show up at our meeting, but if anybody's interested in demonstrating outside the courthouse, it's going to be on October 30th. Now, he was arrested for having 84 plants. At least that's what the police report said. Now, he maintains that he had far fewer plants and that there were a lot of immature plants in addition to the mature plants. But again, this is all just hearsay. So I don't really know, who to believe on that. She said one interesting thing. He said that the police who busted him, and it was state police, they said, because they called in the state police anti-drug task force, and the state policeman said that they would not have busted him if he had under 10 plants. Now I found that
Wow.
an interesting thing to hear. That the police are not even enforcing the law against fewer than 10 plants. Now, this could have been just that single task force, or it could have been just the one person in the task force.
That officer. Yeah.
But apparently he wrote that on the complaint, which I said, well, give me a copy of that complaint. I want to see that written down. But I haven't gotten that yet either.
I'm surprised by that. I mean, that's generally not something that somebody as part of an organization would say or put into writing, that, yeah, even though it's my duty to do this by law, I'm just not going to do it if it's not at least 10 plants. While I would love to think that's actually their mindset, even, you know what I'm saying? Like if that was just, but that's interesting. It is.
I mean, I remember when I went to apply for a demonstration permit for home cultivation at the State House. And I was in there and talking to the state policeman, and they said, well, what's your demonstration for? And I said, well, it's for home cultivation of marijuana. He said, you mean you can't grow your own marijuana? He said, it's a fucking plant, right? I said, yeah.
Well, at the State House, when they had that little 10 by 10 square foot of a plot of cannabis plant.
Right. Yeah.
Yeah, and the state trooper, they just wanted to make sure that now you take them away with you. They didn't want any part of it, because that would have been paperwork. So they wanted to make it go away, and it was like right out in the open, literally.
Right.
And I thought it seemed strange at first, but I can understand how easy their day was after that too,
Mm-hmm. So anyway, that's the latest update that I have. And that's all the agenda items I have.
Wow, timely.
Oh, it's like, wait a second. Hold it.
Hold it, don't go anywhere.
Oh, yes, Ed?
Ken?
Yes.
Oh, I just want to say, before all the facts are in on this recent criminal case, I I don't want us to take much of a position because he really kind of screwed the pooch for us because this sends a message, oh, if we let them grow 6 plants, they'll grow 66 plants, you know? So I'm a little remiss to like jump on board with this until all the facts come out.
Yeah,
Okay.
yeah. Yeah, that's a good point,
And
Ed.
also,
It's all
did-
hearsay
did we-
right now, so.
right. Did we discuss the did I miss the 7 minutes and was all the ASA thing was discussed or voted on?
Oh, um, we didn't take a formal vote. We got good support from the board for the relationship with Americans for Safe Access. And I
Well,
don't
see,
think
I
it's
want
gonna,
to,
I
I
don't think
just
it's
want to
gonna,
clarify exactly what this partnership agreement is.
hold on a second.
Oh. I think it's basically.
I hope you know, I put together this
The,
little overview of what an ASA CMM&J partnership would look like. So,
Question?
this was, try the link out here. Steph sent around CMM&J ASA membership, founded in 2002, Americans for Safe Access, nonprofit patient advocacy organization that ensures access to cannabis for therapeutic use and research. ASA offers a platform for medical cannabis wellness and healthcare stakeholders to engage in projects and programs that address knowledge, policy, and regulatory gaps to improve access to medical cannabis. And then the benefits of ASA membership. And then ASA CMM&J partnership. Follow and repost ASA on social media. They have LinkedIn. They have a Facebook page. They have I don't even know what some of these are. They're on X. Forward ASA's monthly newsletter to the email list. So we would give more information to the people by using ASA's monthly email list, ASA's monthly newsletter in addition to our newsletter. And partners are listed on the website, so they're going to list us as a partner on their website, and give information about New Jersey nationally. They have resources for advocates, information for advocates, and information about CMM&J. It's an affiliate, an invitation to ASA monthly federal policy advisory group meetings. So they have a monthly federal policy advisory group meeting, and we would be part of that. And partners receive discounts on sponsoring ASA events and publications. And let's see, ASA CMM&J membership. I've got to expand this.
Ed, I had made a suggestion earlier if it's possible that they do a little come to one of our meetings and do a little presentation.
Yeah, I'd like that.
But the information is right there in the email that
Yeah.
went around to the board too. So
Just a paragraph and a few
Look,
sentences, really.
look, they're a good group. I've donated to them. I'm just leery about this. Now they're our partner, or we're some kind of subsidiary partner. They list us as, you know, we're the big fish in New Jersey, not them.
What they're
They're the
also
big
asking
fish
is that we
nationally.
do not make this public. That is for our own members.
Well, they don't have any, they would, my interest would be centered more around them not having any domain whatsoever, what we think, do, or say as an organization,
Right.
you know, and vice versa, that can we, do this without really having to defend anything they do, like coalescing, we're a coalition.
Then
So-
at their presentation, they can invite their lawyer.
Yeah.
I mean,
It's
you see how it keeps-
basically partners are listed on their website, so they would post our logo up there.
Right.
you know,
You know,
we
and
get
it would
that.
be, I don't see a bad side to this, but
No, I don't
What
either.
I
I
said-
don't see a
well, I
downside
agree
to
with
it at all.
Ken. Review the material that we have in the email. It's pretty self-explanatory.
Well, it's not irreversible either. If something,
That's a
was,
good
oh
point,
no,
Jim.
we didn't think of that. It's not it's not irreversible.
Right. Good point, Jim.
Okay. But look, like Ken, they said that they want us to send things around to members, but not publicize it.
Yes, so
Well-
I told her that we don't have a member organization, so she clarified that. We could send the information, the reduced membership in ASA to our list of email list, but not to publish it on Facebook.
Right.
Okay.
For what reason?
I'm not sure what a reason. Well, because she doesn't want to offer free membership to everybody. She wants to offer it to the people that we are associated with.
Okay.
Like, how about our patients?
Us. Kind of. There it is.
I mean, if
Reading
we
out
were a
the
member
first part.
organization, but I told her we're not a member organization, but ideally it would, we would just be offering this free ASA membership to people in our organization. So, but, I told her we have 2,000 people on our email list.
We could do this as a pilot program.
Yeah.
Oh, a 5-year pilot program?
Yeah, no,
Yeah.
no,
Yeah,
the-
that operates concurrently with anything else.
Oh,
Right.
there you go.
But
All right.
but take the Jim's opt-out. I like Jim's opt-out idea. Like, okay, we're in, but we can bail out at any time we want.
There's like a 1-page thing here. Couple paragraphs. Congratulations as part of Americans for Safe Access Partnership Program. We're thrilled to offer you a complimentary annual ASA membership. Founded in 2002, it goes over with ASA. That's a nonprofit patient advocacy organization. Next paragraph, our work is guided by shared vision and national framework that chooses to divide between wellness and medicine by fostering the integration of cannabis into patient treatment plans, including frontline options, creating pathways to insurance coverage, investing in the development of standardized cannabis-based products, ensuring a safe and consistent supply, and eliminating employment, housing, parental, and healthcare discrimination. As an ASA member, you'll receive alerts on breaking news about medical cannabis policy, invitations to members-only meetings, events, and webinars, pre-releases of copies of reports and publications, discounts on ASA and PFC trainings, events, and conferences, and special offers from ASA partners. And then just gets into instructions on how to join.
Yeah. There's no
Okay.
downside to this. It can't hurt us. It can only help us.
Okay, so
I've
they're
been a
really
member for
ASMA. They're a
years.
medical marijuana advocate, right?
Americans
Yes.
for Safe Access, yes, they're
Yeah.
medical.
Because
Mm.
that just safe access seems like recreational.
No.
But medical access,
No.
okay,
They're medically oriented.
No,
okay.
re-
Yeah,
re-
I'm happy to give it a try
Great.
with
a
the
little
cheap
bit further
proviso.
than their name. It's pretty obvious in it. They have. This would save me $120 a year because I pay $10 a month as a member for several years now.
Okay, so Mike is
All right.
conflicted, so he can't count his vote.
Not at all. I think you go through it. Definitely, it's pretty self-explanatory. It's a good program. So
You didn't get my joke, as a self-interest would be
Yeah,
Mhm.
I got your
I
excusing
joke.
got-
yourself from voting.
about that, I was just
I got your stinking joke.
Thanks, okay,
I got your stinking joke right here. No.
okay.
All right. So look, it's after time. We have to call this meeting to an end.
Oh, Ken, wait a minute.
What?
So Gary George, the real cannabis and psychedelic entrepreneur, is on the October 18th and 19th, and I'll be doing a couple of panels there on psychedelics. And then also in West Berlin, New Jersey, UFCW is having an event on the 26th, and I'm going to have 1 or 2 panels there as well, talking about psychedelics.
Oh, yes, yes. That was on my calendar, right? From 12 to 6 UFC.
Yep. Yeah, come out for that.
Are we participating in that at all? We tabling there or?
I'm gonna go participate as a non-participant, as an attendee.
Yeah, it's a
You know, but
citizen,
I'm
no
definitely gonna
problem.
be there. Anytime I can go somewhere where they have ashtrays indoors, I'm there.
I don't see why. Yeah, I could. Why not? Right? We should. Huh?
Oh, you know, it's
No, I
like,
mean for Mike. I mean Mike.
oh,
I mean, heck,
Let me.
it's right down the street from me. I don't
Yeah,
have a
yeah.
problem getting the stuff down there. Just
I'll send an email to
didn't get
you.
an invite.
Yeah. Well, you did. You
I'm
did.
sure he
Yeah.
would let you do that, but anyway, I can't guarantee that I would show up to a table.
I get too high there to be of any help. Otherwise I would.
Gaetano, I have has there been a study, just this is a curiosity thing, about any of the interrelationships between marijuana and the psychedelics? Has somebody looked into that?
A study?
As often as possible, Ed.
I'm researching it now. No. Well,
I got my golden messengers in the next cabinet.
I'm just worried about, contraindications, like you have certain medicines, like to tell them, well, if you're doing this mushroom or whatever psychedelic, don't mix that with your marijuana, that type of thing.
You know what?
No.
I'm trying to think. Let me look if there's some. Yeah, something came up too. I was at Philadelphia this weekend, and there was so much information there. I took some notes. I think someone did mention something about that. I can't remember off the top of my head. I'll send you what I find.
If you're going to be like with ayahuasca, where you're going to be purging all over, yeah.
Well,
ayahuasca.
You'll need the pot later to deal with the nausea, but
yeah.
Back in the 60s, we used to use marijuana to come down from the psychedelics. So.
Ed, send me an email of what you're looking for, and I'll find the information for you.
Okay, I just want
to come down from the psychedelics.
I don't want us to sort of like trip over ourselves and get way involved in something, and somebody blindsides us and say, "Oh, you're going to hurt patients,"
In what way? What do you mean?
That if we're advocating like use the psilocybins that I can't pronounce and all these psychedelics, that while you're using medical marijuana, there could be a problem with the results,
I see.
As a patient, your doctor should, or your medical practitioner should make you aware of the, restrictions that medical marijuana has with it. Psilocybin mushrooms is one of the safest things known to man. Ketamine's right up there with it as well. Obviously, people have learned not to go swimming while doing ketamine,
or in a hot tub, right?
Yeah, but that's another story for another day. But I agree with what Ed's saying.
Yeah,
and this is part of harm reduction,
right?
Understanding different harm reduction protocols, they can, especially the ones for psychedelics, apply across the board to cannabis.
Right. Well, right now, right now, all psychedelics are illegal, right? Let's just put it that way, because they are federally illegal. The only legal, and it's not even a psychedelic, is ketamine. Ketamine is a dissociative anesthetic, which they use sometimes as a psychedelic. But so right now, everything's illegal until the New Jersey S-2283 is in place, which is another 18 months away or so.
I'll let you know how the psychedelic comes. I'm waiting for it to be in the mail tomorrow, the next day.
Okay.
I get the Nescamine, the nasal spray.
Oh, Spravato?
Yeah.
Oh, for what are you using it for, pain, Mike?
Yeah.
Oh, okay. Is your insurance covering that?
Haven't gotten that far with it yet. It was $150.
Yeah.
So I just paid for it, and then what I was told, matter of fact, even Jahan Marcoux verified it for me, saying, yeah, it's for chronic pain, it's covered.
Okay, good.
I had to reach out to them and ask for
a super bill
reimbursement.
Yeah, they give you a bill and then you pay and then you put it in for your insurance company. Yeah, I think it is sort of, there's some things that are covered, like so using it for pain. All right. Well,
Yeah, pain, or
but you
the
know
other
what though?
one is for resistant,
Re-
yeah,
Treatment
treatment
resistant
resistant depression.
depression. Yeah.
I have a friend
That,
of mine who
and that's,
that's how I found out about this doctor,
yeah. Well, who's a doctor?
uh, Thomas in Medford.
Where's he or
He's in
she?
Medford.
You know what though? To be honest with you, it might not be covered for pain. I know it because it was approved. It was approved for treatment resistant depression. That I know. And
Mhm.
Johnson and Johnson is going to submit new research and trying to expand the indications. I don't know if it's fully covered for pain though, Mike.
Yeah,
Unfortunately.
the only reference I had to be even covered with pain, I said, was conversation I had with Jahan.
Yeah, but you know the other.
Times, but
No,
you just
I get it.
reassured me that it was. Okay, so
Yeah,
across my fingers. If not,
yeah. Let me know.
we'll see how how it works out.
Well, the other thing that's probably even more effective, to be honest, is the straight ketamine IV for
Yeah.
pain.
Oh, I
And
know.
that's not covered either, unfortunately. But I think from what I heard, at least this weekend, and from what I know in the past, definitely IV or IM is better for that's what you should really try. But try this, fine. It's not extremely expensive, but the ketamine IV for pain is definitely fantastic.
Yeah, I have no idea the size of the dosage or the titration involved. For that is a 1 month supply. I really had. I'm waiting for it to be delivered from.
Yeah.
It's coming up from Atlanta.
Yeah. Well, that's not bad for 1 month, but still, it's out of pocket.
Oh yeah, I mean it's a lot less expensive than IV.
Yeah, it is a lot less. That's true. But if it works, I hope it works for you. But I think the definitely the IV or the IM
Yeah.
will definitely
But
work.
I agree with. Matter of fact, that was what my knowledge of it going into this was, and the doctor differed and said he thought that Spravato would be better for me. I think
Better.
just
Okay.
because I don't know whether I doubt it's going to be something for breakthrough pain. Although
Yeah.
if I'm locked up in pain and not going anywhere, why not? If it ends up being something that can be worthwhile. But from what I talked with him before, it was to be set your alarm up an hour or two before you normally wake up, do a dose then and go back to bed.
Oh, okay.
And the other time was do a dose and then go to bed at nighttime. So it's around sleeping is where he has this.
I mean, I beg to differ with your doctor, but I think the IV works. Well, and
I agree with you. That was my thinking going into this.
But for the price and for what you're doing, it could work. It could work very well, right? So try it. Yeah.
If anything, it's little by slowly.
Yeah, I'd like to know how that works out.
This ends up being giving me some relief. Then I got something
Yeah. They had actually at UPenn this whole weekend. There were a lot of talks on ketamine and Spravato, and there are a couple of providers there, and it was really I was very surprised.
I was too sick to go, man. I've had this really bad bronchitis for a couple of weeks.
Yeah, it was very heavily ketamine oriented in talks and stuff. I was very happy actually about that.
Good. I'm sorry I couldn't go.
Yeah, it's good stuff. So we'll see. I got a bunch of names of providers in Philly and so on. So I met a couple of doctors there that actually have practices and therapists. It was really good.
There's a handful here around Morristown.
Yeah. And there's a couple. There's one or two in Princeton. There's a few around in Jersey.
There you have it.
And actually, I'm working with several physicians out of New York that want to open up a wellness center here in New Jersey, and we're going to be using ketamine, and that's why I'm doing a lot of heavy research. And we're going to be starting off ketamine for pain management.
Yeah, I remember we discussed that earlier.
Yeah. So hopefully,
good luck with that. Sounds like a good venture.
Yeah, thanks. We're going to try and raise the money and do all that wonderful stuff. So we'll see.
Well, you know, New Jersey, go for the neighborhoods where the money's there.
Yeah, well, it's gonna be,
Hey.
well, yeah, yes and no, right? So you're right. We're gonna, because
I
these
mean,
are,
you know they need it in Camden and Newark, but start out
yeah,
in
yeah,
Short Hills.
yeah. So we're gonna bring that on a little bit later. But right now, we're gonna start off with, we're gonna have one part of it's gonna be like a surgery treatment facility. The other
Okay.
part's going to be ketamine for pain, and then later on we're going to bring on ketamine assisted therapy. So that's
Because one of the other applications I have is after my last surgery. They had it was with the pain button.
right.
After my surgery, it was dilaudid with ketamine.
Oh, okay.
Made for the first few days after my surgery was fantastic. It was a whole lot less angst with it. And I think the biggest problem I had was finding the button.
Huh. Yeah, it's fantastic for pain. It's absolutely fantastic for pain.
Yeah, that was I've had it. I've used it topically before.
Oh, you have?
Yeah,
For your neck.
for my neck. For chronic pain, also happens to be this similar area right along the base of the skull, on the hairline.
I need that. I need some of that too myself. Jesus.
I need a compounding pharmacy, my friend.
Yeah, yeah. I actually met a few compounding pharmacists down there as well. But they're based in Philly.
Okay, that's only 20 minutes from my house, dude.
I'll give you their names. They're a nice bunch of people. Yeah, they were there. They had a table there, and they're compound pharmacists.
Very cool.
Yeah. So we'll see what happens. But yeah, come out to the I think I gave you guys all the flyer for the union event. So there's going to be quite a few people there.
For the union event? What do you mean?
The UFCW on the 26th.
Did you post that on Facebook?
Yeah, I post it every day on Facebook, and
I don't know if I'm going to be here for that, unfortunately.
Oh,
but-
man.
okay.
No, I apologize. You said union event, and I'm a soccer fan here in Philadelphia. The team is the Union, and right away it's like you said, the Eagles. But the Eagles, like,
UFCW Union, yeah. They're throwing a big event. And actually, they're very interested in bringing on ketamine assisted therapy as an employee benefit. So we're talking to them about that as well.
Wonderful.
Yeah, so hopefully that could go through. And then
so this is the 26th.
26, yeah.
Yeah, I don't see it posted on the Friends of CMM&J Facebook page.
Oh no, I put it on my Facebook page.
Oh yeah, no.
Oh,
how about the Friends? Put it on the Friends of CMM&J.
Sharing it. Yeah.
Oh, okay.
All right, good. Thank you.
Friends.
All right. Anything else? Way over time.
Look for a major announcement maybe in the next couple of weeks. I think there's going to be a major municipality that's probably going to bring on cannabis as a medical benefit. Just, you heard it here first.
Okay. Hey, did you see my little bit? We're getting our first dispensary.
Oh.
It's literally going to be right next door to the police station. I think you used the same entrance.
Oh, that's funny. Oh, God bless America.
It's like, oh, okay. They're not recording this. No.
Well, I got to go. Move to adjourn.
Yeah, okay. Yeah, I got to go too.
All
right.
All right.
Thanks,
Take care.
guys.
Good night.
Thank you all.
Good
night.
Good night, everybody.
Good night.
See you later.
Can-
Ciao.